Exclusively for Hampton Roads, Cox Communications presents Cox Business Television.
Welcome back to CBTV. I'm Mike Bram. Auto enrollment mandates, individual insurance mandates, fees for employees who are not covered, dependent coverage, tax breaks for businesses that are dependent on how many employees they have. The Patient Protection and Affordable Care Act, or PPACA, is dense and it's complicated and it's here. Joining me now to help work through some of these details are Richard Keatley of Mercer, a leading health and benefits consulting practice, and Cher, Wynkoop, an employee benefit attorney for Wilcox and Savage here in Hampton Roads. Thank you guys for coming.
Thank you.
Thanks for having us.
Cher, let me start with you.
Sure.
In the conversation, it talked like there was so many things to do between now and let's say even 2018, but there's some things that are right on the horizon. Can you tell some of the executives that are watching, what are some of the key things now that they have to be aware of for 2011 implementation?
Sure, Mike. Healthcare reform really brings a sea change to the way employers think about and design their employer-provided healthcare plans. 2010 and 2011 really bring us a tactical list of changes to plan design, plan amendments, employee notices, the beginning of really an unprecedented type of employer reporting to the IRS and various government agencies on the quality and metrics of the health care plans they offer employees. Also, an enormous amount of employee education regarding the plans and the benefits that are offered under those plans.
Sure, there's some things as all of us are going through essentially the budget planning for 2011 right now, it sounds like then that there may be some impactful things that they have to be considering now in the budget process that will be implemented in 2011. Is that correct?
That's very true. Right now, most employers are embarking on the annual enrollment process to open up new plan offerings to employees, generally beginning around January 1. The open enrollment process generally takes place between November and December of the year prior. So we're in open enrollment season now. The things that employers need to think about, one is a small business tax credit that is available for businesses with less than 25 full-time employees, and that tax credit is 35% tax credit growing to a 50% tax credit for applicable employers in 2016. So 2010 offers a 35% tax credit to small employers who offer coverage.
Right.
Some other items that we have to look at for our enrollment is we now have coverage for adult children up to age 26.
Right.
Also, we have no lifetime or annual limits can be applied anymore in plans.
Big changes.
We also have a great bevy of patient rights that have to be included in plans, like 100% covered preventive care services.
Wow. Richard, when you were explaining that you're being asked by so many executives to really help give them some insight, and it's almost taking an extra 45 minutes each time you go out to see these folks, small businesses sound like this is going to be one of the bigger or more impactful in this area. Can you help unpack that a little bit?
Sure. I think any employer that offers an employer-sponsored health benefit plan is going to face some changes in 2011, depending upon when their coverage renews. Right now, what employers are wrestling with is they're wrestling with their renewals and the cost impact that these expansions of coverage will ultimately have on their health benefit premiums.
Okay.
So they're all going through that right now. The smaller employers that may not offer coverage today might be looking at these tax credits and saying maybe it will be more affordable for me to do so in the future.
You know, one of the concerns that I've been having, so let's say the three of us want to go start a company. One of the big incentives we know is a turnaround in the economy is going to be highlighted by new business starts. Entrepreneurs want to get back in. It sounds like, gosh, there's going to be some unintended consequences of this legislation that could maybe hamper people wanting to start a business or growing past that key 50th employee. Can you help us understand how small business right now specifically will be impacted with, over the next 12 months really, either an incentive or a disincentive to kind of wait and start or to expand?
Well, I think most employers today really don't understand the law. If you read the newspaper, you learn about these coverage expansions for children to age 26, for example. A lot of people are calling their HR department right now saying, I want to put my kid on right now, but they might not have to do that yet. So for employers that are offering these plans and are trying to anticipate what they should do from a business perspective, they really need to understand that magic number, as you said. Do they grow past 50 employees? Because come 2014, there'll be some new obligations that they'll face if they're larger than 50 employees or 50 full-time equivalent employees.
Okay. Now, we've got only a couple minutes left. There's so many things. I mean, you were saying that this is some 2,000 pages, and it's hard for even the lawyers and the consultants to go through it all. Are there some resources that you should point people to that maybe either through follow-up seminars or some websites? What's the best way, and I'll start with Cher, that we should tell folks to get ready?
Sure, Mike. Really, employers should start talking with their accountants for things like the tax credits, and their legal counsel and their insurance providers to help them craft the new plan design to make sure that it covers all the requirements of PPACA and the new healthcare reform laws.
Okay. And from your practice perspective, is there anything that's differentiated between small, medium, or large size businesses that they should go in different places to look for information, or one?
You know, I would say that I don't know that there's a good source for small versus large, but I would say that the employer's health insurance providers can provide a lot of great information. Their attorneys, their accountants, their employee benefit brokers should be able to help them with this, or consultants, if they have them, should also be able to point them to resources to help them better understand the law and ultimately craft a strategy to deal with it over time.
Okay. Well, I wish we had really more time to further kind of expand upon this, but I know some of the key things we talked about. This will have impact on compensation packages. There are things and other keywords that you use, the Cadillac program, that might be another thing that the folks should kind of maybe Google and find out about what are some of those key things. And then from your all's practice, I know that you all look at this across the entire country. What I'd like to do is to be able to take some information. We'll post it on our website. We'll be able to have some follow-on. And, I just wanted to thank both you all at Mercer and also the Wilcox and Savage. And for you personally, you provided a tremendous benefit the other day, and I think in this show too. So you're helping our entire communities. Thank you for your leadership.
Well, thanks, Mike.
I look forward to seeing you again next time. Still to come, 3 questions for a local business leader and the latest from the newsroom at Inside Business. But first, more from the Executive Discussion Series.
We're public sector. We take your tax dollars and we spend it. We have no way to increase our revenues. The only thing we can do is try to control costs. One of the things that we learned was that the biggest portion of our costs is related to individual choices. If we change our choices on food, we change our choices on whether we sit and watch somebody play an event as opposed to doing that event, it will affect our health. So much of what is driving our costs is related to managing a sickness as opposed to managing wellness.